we're going to hear about reshaping Africa's health systems for resilience. We cannot have a conversation about sustainability and not talk about health, which across the African countries is in dire straits. Our healthcare sector needs to be reshaped. And closing the presentation this afternoon is Managing Director for Export Development at Afreximbank, Oluranti Doherty. And, we're looking at the pandemic, for example, that exposed the fragility of global health systems. And this now called for an urgency of African-led solutions. This keynote supports Sustainable Development Goal number 3, that is rooted in good health and well-being. And also the Agenda 2063, that's the first aspiration of Agenda 2063. Healthy and well-nourished citizens are the foundation of a prosperous Africa, are the foundation of the Africa that we want. Oluranti, how are you this afternoon?
I'm fine, thank you.
Thank you so much, Mrs. Oluranti, for joining us at the Africa CEO Impact and Sustainability. It's a great privilege to have you. And if you have a presentation, you may project them. You'll be made co-host. Otherwise, Ngozi, you can do that. Once again, thank you for joining us. And we're looking forward to your presentation.
Thank you very much for having me. It's a pleasure to be with you all this afternoon. I would be sharing some of our experiences with you. And then at the tail end of my speech, Ngozi is going to share a video. And then I'll be open to any other further discussion after this. So just to reintroduce myself to you all, I'm Oluranti Doherty, and I'm Managing Director, Export Development at Afreximbank. I oversee the bank's long-term financing interventions with a particular focus and emphasis on healthcare. And I am speaking to you here from the bank's headquarters in Cairo, Egypt. Afreximbank is a multilateral trade finance institution. It was set up by African member countries with 53 member countries on the continent. And we have 12 participating countries within the CARICOM region, of what you know as the Caribbean Community. And we have as our mandate promoting and financing intra and extra Africa trade. We also have as a particular focus to promote value-added exports and trade in services. And it is from the angle of the trade in services that we have given the healthcare sector a keen focus and attention. It is my pleasure to address you this afternoon. I would like to thank the 67 CEOs Foundation, the Nelson Mandela Foundation's official team, and of course, the chairman of Bidvest Group for inviting me to deliver this presentation through a virtual platform. Today, I stand before you to address a topic that is central to the future of our continent. It's the pursuit of health sovereignty, and it's a critical role for multilateral development banks such as ourselves, Afreximbank, to ensure that we secure Africa's health sovereignty. The subject transcends borders, cultures, and economic status. And more importantly, as we navigate the complexities of global health and economics, I believe it's now essential that we understand how these two components intertwine to shape the future of our nations. Let me take a step back and analyze what we mean by health sovereignty. I think it's a term that represents the rights of African nations to govern their own health policies, systems, and infrastructures. And I believe it must be at the forefront of our discussions as a people. Africa is a continent with immense potential and rich diversity. Yet we face monumental challenges in healthcare access and, of course, in having quality health infrastructure. Many nations continue to depend on foreign aid and imported medical solutions, which undermines our sovereignty and prevents us from developing our own responsive health systems. At Afreximbank, we believe we must reclaim our destiny and we must ensure that our health policies are shaped by our unique circumstances, needs, and cultural values. We must always remember that our continent is a home to about 1.3 billion people. Yet when we look at the health sector, we continue to face a myriad of obstacles. Obstacles such as inadequate infrastructure, shortage of qualified medical professionals, and deeply entrenched health disparities. According to World Health Organization, many African countries continue to grapple with high rates of infectious diseases, maternal and child mortality, and also rising burden of non-communicable diseases. And one of the most pressing issues that we all face as a people now is that there's a continuous outflow of patients from the continent seeking medical care abroad, a phenomenon now known as medical tourism. It is estimated that Africa and African countries lose approximately 7 billion United States dollars annually to medical tourism. This is a significant proportion of our healthcare spending, and it goes to foreign nations at the expense of our own development. This not only drains our foreign exchange reserves, but it also highlights an urgent need for us to improve our health systems. But I don't want to come today to dwell on all our challenges. I also want to be able to bring rays of hope and inspiring stories of innovation and resilience that can be replicated across the continent with addressing the challenges that we'll face. One such story is Afreximbank's intervention within the health sector, specifically with regards to the African Medical Center of Excellence, or AMC as we call it. This is an initiative that Afreximbank came up with to ensure that we boost healthcare capabilities across the continent. I'm just going to present to you today an overview of the African Medical Center of Excellence, starting with its origins. The African Medical Center of Excellence initiative was conceived by Professor Benedict Orama, the president and chairman of the board of directors of African Export-Import Bank in 2014, to ensure that we develop world-class medical facilities to provide quality care to Africans. It was supposed to address our challenges in terms of reducing outbound medical tourism from Africa to other continents and ensuring that we stem the brain drain in quality healthcare professionals on the continent. It led to the creation of a 500-bed medical facility in Abuja, Nigeria, which is a pilot healthcare facility developed on the continent. The AMCE Abuja was commissioned on the 5th of June, 2025, and it was done in partnership with King's College Hospital, London. It serves as a center focusing on the treatment of non-communicable diseases, including oncology, hematology, cardiology, and including provision of medical care. And it will ensure that we strengthen our healthcare system on the continent, promote intra-Africa trade in medical services, shore up critical supply chains in pharmaceuticals and health delivery, and also stem capital flight that has been recurring on medical tourism. So the objectives of the African Medical Center of Excellence, as I mentioned to you, includes enhancing health quality on the continent, building research capacity on the continent, ensuring that we train and build quality medical and healthcare practitioners, foster and forge partnerships across African countries on healthcare and medical related matters, and more importantly, promote health sovereignty. For us, the expected impacts of the African Medical Center of Excellence Abuja since its commissioning in June 2025 has been the creation of over 3,000 jobs and the treatment of 350,000 patients within its first 5 years of operation. We also expect that it will go a long way to reduce outbound medical tourism. It would also strengthen healthcare systems, and it boasts of world-class equipment such as 5 operating theaters, an 18 MeV cyclotron machine that produces radioactive isotopes for the effective treatment of cancer, 2 linear accelerators, SPECT CTs, cath labs, and the first 3 Tesla MRI in West Africa, as well as a PET scan. Some of these equipments would push the advancement in qualitative and quality health treatment for Africans within West Africa and even Central Africa. Another thing that we expect the African Medical Center of Excellence Abuja to do is also to boost local economies. We expect that it will increase the capacity of the healthcare sector in Nigeria and indeed West Africa to come out with better health outcomes and to be able to provide treatments to its citizens. One of the things we also know that the African Medical Center of Excellence Abuja will do is advance medical research. And to support this, the board of Afreximbank at our board meetings in March 2025 approved the establishment of the Africa Life Sciences Foundation, which is supported by an endowment board fund to be able to support research into diseases that disproportionately affect people of African descent. It will also facilitate quality healthcare for medically vulnerable at centers like the AMC Abuja and other world-class centers across the continent. And it will boost innovation and knowledge transfer in world-class medical treatments and medical outcomes. The board of the bank has seeded the foundation with a grant of $75 million, and it is our intention to mobilize over $650 million in the medium to long term. And we call on all partners, both strategic partners and donors, to join the bank's effort on this. With the African Medical Center of Excellence and the Africa Life Sciences Foundation, Afreximbank is taking transformative steps to enhancing healthcare across the continent. African Medical Center of Excellence Abuja will focus on delivering quality healthcare research training and will also boost partnership across African health facilities, while the Life Sciences Foundation will enable African-led research into diseases that disproportionately affect us, but have never been given focus across the world or in other climes in the West or in the East. So this is an innovative step from the bank, and with the African Medical Center of Excellence coming upstream and now being operational, we know that it will continue to solidify the healthcare sector on the continent, and it will boost our impact in turning around outbound medical tourism and also brain drain from the continent. At the moment, we are taking on more initiatives and we are advancing the development of new Africa Medical Center of Excellence. We'll be focusing on developing 2 more within Central Africa and East Africa. We want to really ensure that the impact that we've started to make within West Africa can also be felt in Central Africa and in East Africa and South Africa and beyond as we move on. We believe that this is a new health order emerging, and we are filled with optimism for the future because we now see Africans taking our own destiny in our own hands. We see a future where every citizen on the continent and even in the diaspora, we can enjoy a birthright of good health and good well-being. Never again should it be considered a luxury for us. So in conclusion, as we advance the pursuit of health sovereignty on Africa. We know that it's a multifaceted endeavor and that it will require collaboration, cooperation, partnership, investment, and innovation. We also believe that the Africa Continental Free Trade Agreements and area provides us with a powerful platform to be able to enhance healthcare systems across the continent. And that's why multilateral development banks such as Afreximbank will continue to offer our resources, our financing, and our support to turn our vision into reality. We will continue to work together with partners across the continent to create an healthcare landscape that is responsive, equitable, resilient, to support an health system that can reflect our values, and most importantly, that can serve the interest of our people. I would like to call on all CEOs and partners who have joined this event to reach out to us, collaborate with us, because we believe that we all have a role to play in ensuring that we reclaim the health sovereignty of our people and our continent. And as we continue on our journey, we would like to reaffirm Afreximbank's commitments to ensuring that Africans have healthcare as a fundamental human right, to empowering every citizen on the continent to live a healthy and fulfilling life. Together, we can build a future where Africa stands proud, self-sufficient, and resilient in our healthcare capabilities. I thank you all for listening to me. And as I had mentioned when I started, we would like to play a short video which shows you the African Medical Center of Excellence, Abuja, which we launched over a month ago in Abuja, and which is a foretell of what we will be doing with regards to building another African Medical Center of Excellence in Central Africa and East Africa in the medium term. Thank you for listening to me, and it's been a pleasure being with you today. Thank you for watching and thank you for listening.
Thank you so much, Ms. Oluranti. And what a powerful presentation, and absolutely relevant for the Africa that we want. And Ngozi, that was a good job. Thank you for playing that video. There is a saying that an healthy nation is a healthy nation is a wealthy nation. And with what Afreximbank is doing, with the development of Africa Medical Center of Excellence across the continent, and you mentioned also that the one in Africa, in Abuja, is going to represent the West African bloc. There's two coming, East Africa and Central Africa, if I get it correctly. And you kind of landed on Southern Africa also. Are we gonna get a third one?
That is the plan. So we are taking it in phases. Abuja was a proof of concept. We wanted to use that to show that indeed a development finance institution can, wear the caps of a project developer and a project financier. And Abuja is operational. Now we are expanding to consider Central and East Africa. And then very soon we will have South Africa and North Africa. So the idea is to have these centers of excellence across all the key regions of the continent and to be able to now, drive intra-Africa medical tourism. We want to get to a time where gone will be the days where we are saying we are going to India or Turkey or London. It will rather be, I want to go to Abuja or go to somewhere in Cameroon or Tanzania or South Africa or Morocco. So we, that stimulates that intra-African trade in medical tourism.
No, thank you very much. And I would also like to engage you further and then, note that you've spoken about resilience in Africa health system during your presentation. If you may indulge me to ask, what specific role can export development financing play in strengthening health infrastructure across the continent?
Thank you very much. So the role that export development finance can play is, there are various roles actually. One, we can support in preparing bankable healthcare projects and, giving the preliminary project preparation funding for project sponsors. They could be public, private, or public-private partnerships who want to develop sustainable healthcare projects. They need funding to develop bankable cases, business plans, technical studies. They could approach the bank where we provide project preparation funding for projects such as this. And this is one form of what the bank can do. Another form of what the bank can do is senior debt financing, where some of these projects are already developed, they are bankable, but they are struggling because they have the equity, they don't have the debt financing. Within the Afreximbank Group, we can provide debt financing to these projects. We also have a subsidiary company called the Fund for Export Development in Africa, and they are able to invest equity in projects within the healthcare sector. And this could be medical facilities, it could be diagnostic facilities, it could even be pharmaceutical, manufacturing facilities. And just to let you know that the African Medical Center of Excellence is not the bank's first incursion into the healthcare space. During the COVID pandemic, Afreximbank was one of the most reactive institutions. We came up with an advanced payments guarantee that was used to support African governments in procuring COVID-19 vaccines. About 2 billion COVID-19 vaccines were procured from Johnson & Johnson through the support of the bank and distributed across 40 African countries and 11 Caribbean countries. So that was one of the things the bank did. And this was a 2 billion advance payment guarantee that the bank provided to support the acquisition of these vaccines. Even beyond the COVID-19 pandemic, we are working now to develop a 2 billion financing program to quickly shore up the continent's pharmaceutical sector, to boost pharmaceutical manufacturing on the continent, because we know right now we are heavily reliant on imported medical products, therapeutics, vaccines. So we want to critically shore up that to, as we are saying, improve our health sovereignty by ensuring that if there's another lockdown, we are not scampering from pillar to post to purchase vaccines, medicines, or therapeutics that Africa may need.
Indeed, indeed. And honestly, my next question was going to be around pharmaceutical. And you've already touched on that, but I would want to press it further in a different context to ask. And before I ask the question, you also made a call to action to CEOs across the continent and business leaders and community across the continent to engage or to collaborate, as it were, with Afreximbank in this new, era to making Africa, more sustainable when it comes to healthcare. Maybe if I engage on more on the pharmaceutical, I would ask, how can government and private sector collaborate more effectively? So the question context would then be more on effectiveness. So how can government and private sector collaborate more effectively to localize pharmaceutical production and reduce dependency on global supply chains? Madam
Thank you very much.
Oluranti.
My response to that is simple. There are various ways government and private sector can collaborate to reduce our dependence on imported medical products or pharmaceutical products on the continent. And a clear way is for everyone to know our roles and where we are best suited to provide our support. African countries are very burdened with huge debts, obligations. And at the moment, a lot of governments are shying away from, investing in projects and etc. themselves. However, there's some role the governments can play, and that is in creating an enabling environment to attract private investment. Private investment locally, private investment from Africans in diaspora, or even private investment for anyone who wants to invest on the continent. And some of this is in coming up with good policies and regulations that support and attract investments, and ensuring that when people do invest in our countries, they are able to do so in a sustainable way. We have been working with our member countries to encourage governments that there are roles for them to play. And in financing or supporting projects, we could look at the PPP approach as a veritable tool for scaling up investments on the continent. And we should do what government is best suited for, which is at times provide the land, provide regulatory support, provide policy support to ensure that these projects are sustainable. Because for any businessman, a private sector investor, as long as they can guarantee their returns in a sustainable way, they would invest. So I think that is what we need to do from the government side, and in attracting both local investment from the private sector and even investments from Africans in diaspora.
Absolutely. Thank you so much for that response. Colleagues and delegates in the audience, please type your question in the chat so that I can present them to Mrs. Oluranti. If we may touch on small business or micro, small, medium enterprises, MSME. and some of the things that the Afreximbank, because I know for sure the role that Afreximbank is already playing in that space. But if we focus more on health sector as relates to SMME, what innovative financing model have proven successful, in your opinion, in supporting health-focused SMMEs and startup in Africa?
Thank you very much. For us at Afreximbank, our support for small, medium scale enterprises led us to creating a bespoke program called the Export SME Development Program. That program was to support SMEs within the export value chain to scale up their businesses across the continent. And for us, healthcare was one of the sectors we did consider because we, like I said to you, look at healthcare from is trading services and an opportunity for even trading in intra-Africa products. And so we went into partnership with local financial institutions in terms of capacity building support for SMEs within the medical healthcare value chain, because most times the challenges are not only skewed on financing. Sometimes the challenges are capacity building in terms of building strong operating systems for these SMEs, market access for these SMEs, teaching them how to export and how to connect to the regional and global value chain. And then you talk of financing. So we made sure that our program was multifaceted to capacitate, to provide advocacy support where necessary in terms of engaging governments for enabling environments for SMEs to thrive. And in terms of market access support, we've used various platforms, including our biannual Intra-Africa Trade Fair, to launch SMEs on a regional and global scale. And we have the next Intra-Africa Trade Fair coming up in Algiers from the 4th to the 10th September this year, Algiers, Algeria. And we are still going to be showcasing some SMEs sponsored by the bank at the Intra-Africa Trade Fair in Algiers, connecting them to, the regional and global value chain businesses that could help them, expand on a regional level and on a global level. And then the last one is financing. And in financing, we've looked at this from various components. We've looked at it from on-lending to local financial institutions. In last month, we just signed a partnership with some local financial institutions to the tune of 75 million euros to support healthcare and pharma SMEs, which we expect to finalize and ensure their disbursement. But what is unique about our program is that we don't just give this funding to the banks and close our eyes and move on. We give it to the bank and we agree the intermediaries and the sector focus. And we ensure that these funds are disbursed to these SME businesses. Then we have a monitoring process after the disbursement to sit with the SMEs to evaluate the impact of this funding on their businesses. And when these SMEs scale up, then we move them to the level of corporates that can now on their own directly access financing from a multilateral institution like ourselves. So this is what we've been doing within the SME space to support and scale up African SME businesses.
No, thank you very much. And like I alluded earlier, I, for one, can, attest to the support that the Afreximbank is giving to small business ecosystem. And guys, esteemed colleagues in the audience, drop your question in the chat. Otherwise, it's just going to be myself and Ms. Oluranti, and I'm not complaining. It's a privilege to be having a robust conversation with her, especially when it comes to health-focused conversation like this. In your own opinion, and if you may, give recommendations when it comes to Africa health sectors, how can they more strategically align to, for example, your SDG 3 about good health and well-being, and also in line with Agenda 63 that talks about health, resilience, and things like that. So while the health sector in Africa, aligns and kind of make impact in that regard, um, and they have to remain, commercially sustainable also while they make impact in the health sector across the continent. So again, in your own recommendation, what are some of the things that they can do to bring balance between making, sustainable impact in health sector across the continent and also remain commercially viable?
Thank you very much. One of the key initiatives that I mentioned to you that the bank came up with in March this year was the creation of the Africa Life Sciences Foundation. We believe that it will be a game changer in terms of, ensuring that we get the quality healthcare we want on the continent. And you may ask me how. You see, a lot of times we have been at the backstage in terms of innovation, research, development in healthcare. And with that foundation, we want to place Africa at the forefront. We want to ensure that we boost and encourage research into diseases that disproportionately affect people of African descent. A clear case is sickle cell anemia. Uh, for over the years, we've still not found a very sustainable cure for sickle cell anemia, and it's because it is a disease that only affects people of African descent. But Afreximbank has, with this foundation, been able to bring focus back to such kind of diseases, to fund research in them, innovation in them, creation of cures and treatments that result in better outcomes. And this is not just the only one. The Africa Life Sciences Foundation will also be looking at ensuring that medically vulnerable are not left out in accessing quality healthcare on the continent, not only at our African Medical Center of Excellence, but at other institutions across the continent. And then also looking at health programs that we need to champion and focus on that affect us. And let me give you a case in point. Across the Sahel region in Africa, there's been a huge incident of unrest, terrorism, kidnapping, etc. But it has also been traced to use of drugs within that region or abuse of some drugs. So advancing programs that speak to mental health is also important, but no one will do it because it doesn't affect everyone on that scale, but it disproportionately affects us. So these are some of the things that the Africa Life Sciences Foundation will be focusing at doing. And I think that's why we are calling on other like-minded partners, strategic partners, donors to join us. Afreximbank is seeding the fund and the foundation with $75 million over the next 5 years. We join on others to join us on this journey to be able to scale up the fund and the foundation and to have that great impact in changing the healthcare landscape. Now, if you can do all this, you advance treatments, you advance drugs, development of drugs on the continent, development of cures on the continent, strengthening the healthcare system, preventing brain drain, creating regional research institutes that just are churning out, cures and
Yes.
innovation in healthcare for the
Yes.
continent.
Uh, I was just beaming here to here because honestly, there is nothing to add on top of what you just landed on, because when that is considered in terms of what needs to take us forward as Africa, and we become more prosperous because that is what the Africa Agenda 2063 is championing for, a prosperous Africa. And I mentioned earlier that I I quoted earlier that a healthy nation is a wealthy nation. The more we are healthy as a continent, the wealthier we will become. And also considering that it is, projected that by 2050, Africa will have 1 in every 4 workforce, and our youth demography also is growing. And we cannot have a sickly youth demography. We have to have a very healthy youth demography and a sound, youth demography also, which speaks to what you mentioned earlier about mental health of Africa and youth in this regard. Mrs. Oluranti, it's been a great privilege, hosting you at the Africa CEO Impact and Sustainability Meeting 2025. And what a way to close off the conference for the year 2025. And I don't know if you would like to give your parting shot at this junction.
Thank you very much for having us and for inviting the bank. We do hope that people have been able, the audience, the CEOs attending, etc., have been able to listen to some of the interventions that we are doing. Like I said, we know that for us to be able to make the great impact we need to, showing up Africa's health sovereignty and resilience, we need collaboration, and we invite everyone to join us on our journey and to be a part of our success story in creating the Africa we want. Thank you very much.
Thank you. Thank you very much. A prosperous, healthy, and wealthy Africa is what we want, and it's our responsibility as a collective to be able to ensure that is delivered. And once again, Mrs. Oluranti Doherty, thank you very much. Thank you. We're so grateful to the Afreximbank for participating at the Africa CEO Impact and Sustainability Meeting 2025. And not just participating, it's been, since May, it's been a very fruitful, conversation and back-to-back. And hopefully, 2026, as our plan was for 2025, we are able to host a physical, gathering where it is more engaging, even more than this. Thank you once again.
Thank
And
you.
to esteemed colleagues in the audience, for those that have joined us from the 15th of July 2025 at the Africa CEO Impact and Sustainability Meeting, and 15th may be being day 1, then yesterday day 2, and today day 3, and the concluding sessions for the conference. We're so grateful for having you, and it's been a lot of robust engagements, and we hope from here that we begin to act on some of the things that have been shared by business leaders and even leaders from the public sector that have come up here during the conference to share the things that will help us to make more socioeconomic impacts, sustainability actions, and deliver the Africa we want. Once again, it's been a privilege as the executive convener of 67 CEOs Foundation to host you all. And I wish you well, and God bless you, and see you all at Africa CEO Impact and Sustainability Meeting 2026. God bless you, and God bless our beloved continent, Africa. Bye.